So we've got a first question today for our distinguished panel. And the question is as follows. It's concerning the organizations that are already in place. For example, here in Quebec, we've got users committees in all health institutions in Quebec. And we've also got some organizations that represent people who suffer from different illnesses. And this exists elsewhere in the world, these types of associations, except for the users committees that are specific to Quebec. The question that I've got for you, when it comes to defending rights, when it comes to advocacy, as we often call it, how do you see today the integration of advocacy in the patient partnerships in our healthcare system? Well, that's a very simple question. I'll speak both in English and French as a good Canadian.
Depends if you're talking about an institution or if you're talking about healthcare in Canada. I think that there's a really important place when we're talking about healthcare in Canada for organizations that in healthcare would be the equivalent of Greenpeace in the environmental movement. You know, we all need Greenpeace. A friend of mine runs Canadian Greenpeace, and I always expect to find her hanging off an oil platform somewhere. But we need organizations that put the question starkly and remind us of our moral responsibilities. Patients Canada is a beginning of that. It's a tiny organization. I think that within institutions have responsibilities for patients, so the rights of patients are included. But that's in that case, it seems to me, the way in which that actually operates is rather different. And when you have patients being part of co-design, they don't leave the moral imperative behind, but it requires a different range of skills to participate. But I'm a big believer in the radical organizations out there starkly putting the question, because it reminds us all of our responsibilities and it reminds us about what's missing.
Est-ce que vous auriez soutenu Greenpeace il y a 2 semaines avec le gouvernement?
Would you have supported Greenpeace 2 weeks ago as openly when we had a conservative government? That's the question. So are there any other comments on this question? There are elements in the Users Committee that are legal aspects, defense of rights, being one of the roles of the Users Committee. The respect of these rights is something that remains independently of the approach of partnership and care, and it's a right, and it must be there and must remain, must be defended, and the right questions must be asked at the right time to the right people. The link between the partnership approach and the Users Committee is still to be defined, because we're more in organizational elements here. The representation of members and the Users Committee and the involvement in the partnership approach is something that we want, but at the same time we talk about recruitment, methodology, objectives, and everything. So we have to see how we can build together where the partnership is possible and what we develop as an approach for partnership. And as a Users Committee of the institution, does it have the right profile, the right people? So everything is yet to be built. So it's we hope it'll be co-construction in the implementation of these with the baggages and experience and the approach and consolidation in these institutions. I agree, but I think that when we asked us to close our eyes this morning, I was thinking in 20 years, if there are partner patients at all levels in our systems, maybe we would not need these users committees and people who will work as Greenpeace in the healthcare system. But it might be a pipe dream. But if there were patients that would help us to decide everywhere in different and to talk about different models that we want in the clinical environment, and patients that can influence research that we do, that can be on boards, that can be everywhere in the organization. Kingston, even they have patients that are on the different selection committees for executives. So I think maybe in 20 years or so, if we think that what we're doing in the healthcare system is really for the patients and with the patients and by the patients, if they have their input everywhere, we wouldn't need maybe all these advocacy groups, because what's happening is, what I'm seeing is, it's becoming very politicized, and it's becoming a story of silos, us against them, and that's where we get into a combat mentality that's really difficult to manage. So for me, that's what I think we should think about.
Have I pressed it enough? Yes. I agree with that. I think we may see a shift from what is essentially a rather bureaucratic model at the moment and very organisation focused. And of course, because the big organisations are the hospitals, it's rather hospital focused. And I think we're going to see a shift to much more general engagement, which will span everything from the home to palliative care, you know. But I suspect we will always need people who are willing to challenge professionals, and that's an important part of the advocacy role, and who are willing to ask the difficult questions, and sometimes be confrontational. But actually, the real skill is moving beyond that to the partnership that we've all been talking about all day, and having the new ideas and developing new services in a collaborative way. And I think we'll be seeing a shift, as somebody said earlier, to a more patient-led system. That doesn't mean that professionals won't be running the organisations. They will, because it's a very professional job. But we won't. The divide that we're seeing at the moment and all the things we have to put in place to overcome that divide, I think will hopefully disappear.
On est donc à la naissance de nouveaux modèles de gouvernance.
So new models of governance. I'm an old activist from the 90s, so I think there are contexts that will still demand advocacy in certain times for questions of defense of rights or certain issues. But I think today we see patient engagement that takes other forms and has more diversity with a much stronger leadership within the organizations themselves. That's the difference, is there's a development of leadership not just outside but inside the organizations as well, and it's a great thing. So the question I want to ask now, and we've seen this in many examples today, research is starting up and education, and to follow up with efforts, and the institutions, and public policy is changing. So we have representatives from academia, political representatives, government representatives, and also people from the healthcare system. So how can the different levels interact? What will be the different interactions of these different levels for the future? It's a small, tiny question, an easy question, really. The role of the different levels, I think, firstly, the road towards ministerial orientations, government orientations for Quebec is really based on what we've accomplished in the different institutions from this partnership with the patients. So it really created a bottom up. We often see top down, but now we're seeing some bottom up, and this importance is really felt, and we see that in the government. So I think to really support these different actions at different levels, we have to have ministerial or government organizations that are orientations that are very clear and that integrate into governance, the culture, vision, and principles, and that part of a strategic plan from the government, so that we can really recognize the priorities of actions by institutions with the patients. So as that's already, we've seen that in different organizations. So it would be important on a ministerial level to be able to support the development of practices and working with other professionals and working to develop profiles of skills and to be able to have a partnership approach that is seen as much in governance and organization of services, but also in delivering services and the different patient experiences on an individual level. But I think there's a lot of elements that must emerge very clearly at a higher level, at a minister level, to recognize and support these things and favorize the implementation and the durability of the partnership in healthcare with the patient and the user. We need a close partnership.
There are two things I want to speak about. One is to learn from what the UK has done in defining the way in which research ought to be done and the way in which patients' views and patients ought to be included within it. That parallels the huge struggle that took place during the 70s to get any attention paid to implications for women of whatever research was going on. That was a whole struggle, which may not be over. And the other is in the development of public policy. Because, I mean, we've just been through a kind of dark decade at the federal level where nobody was consulted, never mind patients. But so the capacity of the public policy apparatus, the functioning of the public policy apparatus at different times during different political contexts is more open or more closed to other views. I think it's really important for those of us who think that policy is better if patients are included in its development, need to think about how to do that practically. In Ontario, for example, they've just put out a new primary care approach. There were no patients or patients groups involved in the elaboration of that. They're sort of embarrassed now because they also have another strategy of putting patients first. But that didn't cross over to the actual substantive policy development area. So I think it's extremely important to focus on that. And as we've been able to do in institutions, think of the practical ways in which that's going to happen. Because, no policy ever goes from public consultation through cabinet with everybody's views intact. But I don't think that's the point. The point is at the time when you're gathering your ideas about what to do, you need to include patients, not only evidence from the literature. Also, the other thing I have to say, I actually turned out to have three things, is it's awfully difficult, and that's why I'm so impressed by the University of Montreal. We have this huge research, well, not huge, but substantial in Canada, body of researchers who focus on health services and policy research. But the incentives for them are not to get engaged in policy development. Well, certainly not if you're a young researcher. You'll never get tenure. So there are incentives in the world of research and in the world of policy which are different. So understanding that and understanding how then to maximize the huge knowledge that sits within universities, how to make that active and much more public, the way in which I think the University of Montreal has done in a very impressive way.
Just a couple of comments as well. I totally agree that at the federal level, we need to have policies, especially in regard to patient engagement in this country. And I fully understand that it's the province that has the jurisdiction of health. But as a country, I think we ought to position ourselves and do that. The second point was about University de Montreal. Of course, I declare conflict of interest because I just finished there. But I think that preparing healthcare professionals in an integrated way, keeping in mind that you're working with the patients as partner, is absolutely brilliant, and that's the way to go.
Anja?
And of course, I come from a country where we have the opposite. we don't have very much devolution to our equivalent of the provincial level. We have a very centralized system. But interestingly, our government is trying to push us in a more devolved direction. And that's I think, going to be a good thing. We do have, however, a great deal of support, political support, from actually all the parties who've been in power recently for more patient engagement. That doesn't mean we do it very well always, but we do at least have, that is the direction of travel and has been for really quite a long time, and it's been very important. Mm-hmm. It does mean that at most policy levels, you wouldn't dream of having any kind of discussion without involving patients. But I think what we've essentially been talking about today and more generally in this area is actually a profoundly political thing. It's about democratizing healthcare. And that's good. We want people to have these debates. We want to debate what we haven't talked very much about today, and possibly because the mechanisms for doing this are different in Canada than they are in the UK, but we haven't talked about determining priorities for the expenditure of resources in healthcare, for example. We're not great at that either, but there are those debates beginning to happen, and they, sometimes pretty fierce debates, but I think that's fantastic. That's engagement, isn't it? When people feel confident that their views can come to the surface and be discussed in a grown-up kind of way. So I'm all for engagement at the political level, democratization of the discussions about priorities. And it's possible that actually you can do it better than we can, because it's hard always to operate at a national level with a population of whatever it is, 66 million, or maybe it's 70 million. It's harder for many people, particularly those whose voices tend not to be so well heard, to operate at that level. Whereas if you have a more devolved system, if you are quite clear about where the appropriate decisions are taken, then you have a greater chance of being able to involve the people who matter in this, which is the patients.
As a follow-up question, and we've talked about this a lot during the day, many presentations probably addressed this question, but maybe if you can summarize, in your view, the link between patient engagement, healthcare quality, and system performance.
Ce sera la dernière petite question.
This will be the last easy question of the day, and we can all go home. I believe that it's completely integrated. Everything is integrated. These are links of the chain that we cannot separate, and we're starting to understand that. We had a great meeting in Calgary this week, Monday and Tuesday, with the public health care instances there, and the doctors surprised me on this level of understanding of these elements and also the desire to work on this. I left there flabbergasted and excited, because it must come from our professionals, the practitioners. And if we want to start to think about integrating all of this, the research has demonstrated very clearly. I won't name any names, but Dr. Coulter has talked about it today, and a lot of other people too. It demonstrates that when the patients are listened to, when they are part of the decision-making process, our results are much, much better. I think we saw this many times. Okay, I'm good. So I think it's really strange that to speak it's red and to stop is green. It's kind of counterintuitive, but anyway, they haven't consulted us on that. Well, yeah, you see, that's what happens. So I think that this is the theme today, was exactly that. And so when I think about the first examples of the work done by Paddy O'Connor years ago, we've seen in all the work that has been done that The changes that have increased safety and security for patients have also decreased costs. So the relationship between patient engagement and the quality and the costs are very, very much linked together. We got the system now. We understood. Well, we learned, yes. Okay, well, very quickly. The links are indissociable. We came through the door of quality and talked about partnership, but at the same time we have relationships with in relation to performance, but impacts are seen everywhere, and we can measure different parameters and different according to different priorities internationally in different institutions. We can look at different elements of quality and performance depending on where we put quality and performance and how we define things semantically, but it's indissociable, and the partnership must be considered in the continual improvement of the quality of care, and so it has a very important place for quality and performance.
I think that is happening, and we heard about it today, is new thinking about measuring value, because we can't look at system performance unless we think about how you measure value. And the shift that we're seeing is measuring value from the patient's perspective. So moving away from, the clinical indicators are always going to be important, but actually they're not the only important thing. Asking patients what's important to them and then measuring that. And then looking at the cost effectiveness of initiatives to improve that is where we're moving to. And the nice example of the patient-reported outcome measures and using those and making those measures available not just at the sort of high level of, working out what kind of value we're getting from the whole system, but also helping the individual patient and the individual clinician monitor their own health and making decisions on that basis. That's another really important development, I think, that is going to be a game changer.
Alors merci, on vous remercie pour ça.
Thank you for this. I think Mario also we'd like to thank, because the patients have a really important place yesterday and today. So I'd like to thank McGill University, the Research Institute, and for the place you've given the patients and the leadership you've shown in these questions and these issues. So just the fact that there are so many patients here and that have participated so actively and have a great place, so it shows that we're progressing in Canada and that things are happening thanks to the research and our companions and the foundation. So as a patient, we are pretty happy tonight, I think. Yes, I think it's really a great success. I've seen a lot of patients and families here today, and I think that motivates us quite a bit to see that they're really integrated into the process, and it's not top-down, and there's a real desire to move forward with these partnerships and to have them as much as possible in as many places as possible. So thank you to the organizers, thank you to the McGill University Health Center, thank you to the Research Institute, thank you to the people who organized all this. We hope you have a great trip home, and thank you for being here today.